Injuring, killing, or otherwise harming people is wrong. We have a moral obligation not to inflict harms on other people. This is the moral principle known as nonmaleficence, which we can define a bit more precisely as follows. We have a moral obligation not to cause harm or risk of harm to others. In this video, I'll cover some important aspects of what this principle means and how it directs us to treat other people. To understand a little better how this principle of do no harm guides us through difficult choices, we first have to understand what is meant by harm. Now, philosophers are a picky bunch, so you shouldn't be surprised to hear that there is more than one definition of harm floating around out there. So I'll just cover one major definition. Let's say that someone is harmed by some event just in case she is worse off than she would have been if that event had not occurred. So, someone is harmed in a car crash if her car is damaged or her leg broken. And one harm is worse than another depending on how bad off that event leaves you. For instance, the car crash would be a greater harm to the driver if she broke not only her leg, but also her arm and ribs. Now, the principle of non-maleficence tells us that we shouldn't cause harm. But we can fill this idea in a little more. For instance, we can say that the obligation to not cause harm becomes stronger as the harm or risk of harm becomes greater. Suppose, for instance, that testing an experimental drug on patients, even if they consent, has a high chance of causing significant harm, such as severe impairment or even death. The moral constraint against conducting such experiments is surely quite strong. By that I mean that the reasons needed to justify those actions would have to be extremely strong. Perhaps doing so is the only way to save entire populations from an extremely fatal disease. But the constraint against causing harm or a risk of harm becomes weaker if there is a low chance of a mild harm. For instance, administering well-tested and studied vaccines come with some mild risk, but the risk is generally so low and the common adverse effects generally mild that the constraints against causing harm or risk of harm are very weak, at least in this case. In other words, the reasons needed to justify administering well-tested and studied vaccines with few side effects, even if they cause discomfort for the patient, don't have to be as strong as the reasons needed to use a very dangerous drug in clinical trials. The benefits of the vaccine seem to outweigh the risks in many cases. This last point is really important since it shows us that causing harm is importantly different than wronging someone. When a child receives a vaccine, they may be harmed because it causes them pain or distress. But the child has not been wronged by her parents. And, in a similar way, someone can be wronged without being harmed. For instance, suppose that a wife cheats on her husband while away on a business trip. Imagine that her husband never finds out about her unfaithfulness and lives his life no differently than he would have if his wife had not cheated on him. In this case, his life is not made worse off by his wife's cheating. He wouldn't have lived any differently. So, he isn't harmed. However, his wife surely wronged him by being unfaithful. So it's important to keep in mind that claims about harming are different than claims about wronging, although, as the principle of non-maleficence indicates, the two are intimately related, even if they're not identical. Before wrapping up, there's one last point to make. Constraints against not causing harm might be stronger than constraints against failing to do good. In other words, non-maleficence might, in many cases but perhaps not all, be stronger than other duties, such as the duty of beneficence, the principle that states that we ought to do good to others. That might be the case because when we go against the principle of non-maleficence and cause harm, we have failed to fulfill a negative duty. A negative duty, or obligation, is a duty not to do something. And the principle of non-maleficence represents one such duty. On the other hand, failing to benefit someone is failing to fulfill a positive duty, where a positive duty is a duty to do something. Those duties are ones that claim you ought to act in a specific way. Some philosophers have argued that negative duties, for instance the duty not to cause harm, carry greater weight than positive duties, such as the duty to do good to others. The reason provided for this claim is that it would be worse for you to cause harm than it would be for you to allow that harm. And maybe the idea is plausible. You might think, for instance, that it would be morally worse for you to steal someone's food and cause them to starve, thereby violating a negative duty not to cause harm, than it would be to fail to donate to charity, thereby violating a positive duty to do good to others. If you think that it's worse to cause others to starve than to fail to donate to charity, then you might think that the principle of non-maleficence, at least sometimes, carries more moral weight than some other moral principles. Thank you for watching 5 Minute Ethics. Please like.